Okay, great. Thanks, Mary. We're going to enter into part 2 of the webinar today, and this is really the getting started, the how do I do it portion of the webinar. So we're going to start really with the checklist for preparing for and participating in MIPS. And it's my pleasure to introduce another colleague, Dr. Ashby Wolfe, Chief Medical Officer for Region 9 at CMS, and a family physician to run us through this list and give us some pointers on how to get started.
Thank you so much, Adam, and good afternoon or good morning, everyone, depending on where you're accessing the call from. It's my pleasure to be here, and I am going to be walking you through this final segment where we'll discuss the practical aspects of the program, the how-to of participating in this MIPS pathway of the Quality Payment Program. And thank you to Molly and Mary for that detailed review of MIPS. I'm going to try to break down some of what Molly and Mary discussed and described on the next several slides. So if we move to slide 52, you'll see a checklist. Really, we hope this will be useful to you as clinicians, as practice managers, as part of the care support team in preparing for participation in this transition year 2017. And you'll see on this slide there are a number of points to take a look at. I'm going to be walking you through each of these checks in the next several slides, including looking at how you determine your eligibility, how you might choose to submit your data, what submission method to look at, and how to choose your measures, etc. This checklist is really meant to serve as a general guide to every clinician who would be participating in MIPS, regardless of your level of experience with prior reporting programs like PQRS or Medicare Meaningful Use. So we're going to walk through each of these items. Just remember, this checklist is really a means to help you get started. You have the flexibility to determine how many elements are really applicable to you in your practice, and don't feel that you need to complete this checklist in order or all at once. We're going to talk through each step, and you can really personalize it as you see fit and as it would be helpful. So moving through slide 53 to slide 54, let's talk about that first checkpoint, determining your eligibility. So how do you do this for your practice? Well, to go back to the eligibility piece that Molly mentioned earlier, really it's a question of determining your annual patient count and billing amount for Medicare Part B. And getting back to that specific question, did you bill more than $30,000 in Part B allowed charges and provide care for more than 100 Medicare patients in a given year? Again, this applies to Medicare Part B fee-for-service. So really taking a look at your claims of service provided between September 1st of 2015 and August 31st of 2016 will be key in order to determine your eligibility. Now, CMS will be providing additional information to you this spring to help you in this effort. The key thing I want you to take away from this is that there is this two-part piece to the eligibility. If you are a physician, nurse practitioner, PA, certified registered nurse anesthetist, or nurse specialist, you have to be able to answer that question, did you bill more than $30,000 in Part B allowed charges and provide care for more than 100 Medicare patients in that year? Now, as I mentioned, CMS will be providing additional information to help you determine this eligibility, and we've been really deliberate to make sure that all clinician information is up to date and that our eligibility data is accurate. So let's move on to the next data point, the next decision point here on slide 55. How do you choose to submit data? Do you participate as an individual or as part of a group? So on slide 56, you'll see this particular checkpoint, and eligible clinicians have two options for participating in the MIPS pathway, as was mentioned previously. You can participate as an individual, meaning that you as a clinician would report information under your unique National Provider Identifier, or NPI, combined with your tax identification number, or TIN. So using this combination, we can identify you as an individual participant in MIPS. Alternatively, if you and at least one other clinician in the group would like to participate as a group, we would take a look at your data under the single tax identification number to which you and your fellow clinicians have reassigned your billing rights. So it's important to note that if you as a clinician decide you want to participate as a group, your group is assessed as a group across all of the MIPS performance categories. Now, we encourage clinicians to begin discussing how they want to participate in this performance here. It's not just about knowing that this choice exists. It's about talking to your clinician colleagues, if you have them, and really identifying the best option for your practice and the population of patients that you're serving. Now let's talk about the next decision point, choosing a submission method. And how do you do this? How do you get your data to CMS? So on slide 58, you'll see a few suggestions. The good news is that if you have already been submitting data to CMS through either PQRS or Meaningful Use, for example, chances are you are already familiar with some of the submission methods that we have as options to report in the MIPS program. As was mentioned earlier, depending on whether you're participating as an individual or as a group, our submission methods for MIPS include claims, attestation, qualified registries, qualified clinical data registries, electronic health records, and for groups of 25 or more, the CMS web interface and the CAPS for MIPS survey. So in making this determination, it's very reasonable to speak with your specialty society or to get additional help through one of our technical assistance contractors. You don't have to make these decisions on your own. We have a list of technical assistance that's currently available on our website. As was mentioned earlier, you can visit qpp.cms.gov for information on your submission options, as well as information about using our technical assistance program for decision support. So let's move to the next decision point. Now that you've made some initial determinations about eligibility and about how you're going to get your data to CMS, you can prepare to participate in 2017. So on slide 60, you'll see a couple of additional suggestions about how you do this additional preparation. So thinking through your practice readiness, if you've previously participated in a quality reporting program like PQRS or Medicare Meaningful Use, that's an opportunity where you can build off what you've learned already. Additionally, think through if you're prepared to begin reporting data for the 2017 transition year. You can review the options for participation, including whether you simply want to test the system, as Molly was mentioning earlier, or if you'd like to participate more as a partial year participant or for the full year. So there's a couple of different pieces here on this slide that are worth thinking about as you begin to plan your method of participation. Now let's talk about the data itself. What information are you sending to CMS and how are you going to make that decision? So moving through slide 61 to slide 62, this slide really details some of the information that would be helpful as you choose your measures and activities, what data you will be sending into CMS. Step by step, you can review the measures or the improvement activities that make the most sense to you based on your specialty and your scope of practice. So we highly recommend going to qpp.cms.gov and clicking on the Explore Measures tab right at the top of the page. That will take you to an opportunity to review each of the performance categories that are available in MIPS. And you can select a performance category of interest. You'll have several different ways to sort this information, looking critically at the quality measures, the advancing care information measures, or the improvement activities. And depending on which performance category you choose, you can actually search by keyword, by specialty. You can even search by method of submission. So for example, if you are a clinician who wants to report a quality measure or wants to take a look at what quality measures match up with your specialty, and let's say you take care of a significant number of patients with arthritis, you can actually go to the Quality Measures tab, type in the keyword arthritis, and the tool will actually sort for you which measures are applicable there. You can also search by specialty. So if you're a dermatologist and you want to see what quality measures apply to you, simply use the drop-down menu and you can identify which quality measures apply there. By searching these different options, you can actually see all of the information that's pertinent to that measure or to the improvement activity that you're interested in reporting. Now moving on to slide 63, a couple of tips to think about here. So definitely consider your patient population and the clinical conditions that you treat. It's worth thinking about what areas of your practice might be the most amenable to practice improvement goals. For myself, I'm an actively practicing family physician. I continue to see patients as part of my job at CMS. And for an example, if I wanted to really look critically at my patients for whom I'm treating for diabetes, I could really make that a theme in terms of my practice improvement goals, looking at focusing on increasing diabetic control among my patient populations, choosing quality measures, and perhaps an improvement activity that might support those goals, and being able to sort through on the measures tool the valuable information that would then be provided to me in the CMS feedback reports. So those are things worth thinking about as you're selecting what measures and improvement activities or advancing care information measures are the most applicable. Now, for those of you who have not participated in PQRS or Medicare Meaningful Use, you may not be as familiar with the existing feedback reports that clinicians receive under those programs. The Quality Resource Use Report, or QRUR, is currently the way we're providing information to clinicians who are participating in our legacy programs. It's a report card of sorts provided to clinicians by CMS, and it provides an overview of the quality of care that clinicians are providing to their patients, as well as a review of the cost of that care. That quality information is actually pulled from PQRS data, and the cost information comes directly from claims. So if you're a clinician who has been participating in PQRS or Medicare Meaningful Use, we would highly recommend that you take a look at your existing QRUR to potentially identify measures that could match up with your practice improvement goals as well. Now let's move on to slide 64 and talk about how to verify the information that you need to report. Slide 65 provides an extensive list of this information, and I do want to emphasize a few key specifications that may be helpful to you in reviewing the information that you need to report. Taking a look at the measure number, the measure title, of course, is important to know which populations are applicable there, and looking at the submission method option. Not every quality measure or improvement activity can be submitted by the same submission method. So looking at what submission method makes the most sense to you is very important. Additionally, the measure description and instructions on reporting, as well as the criteria for the measure, are key things to take a look at. And remember, many of the measures for MIPS are measures that have been developed by specialty societies. They've been rigorously tested and validated, and some of them have been in use previously in PQRS and Medicare Meaningful Use. So some of the measures will probably look very familiar to you if you have been participating in those programs. The new elements of MIPS is the increased flexibility, so making sure that you as a clinician can pick measures that match up with your specialty and your scope of practice. So definitely taking a look at these details will be key ways to assist you in making a decision. Now let's move to slide 66 and then 67, and finally talking about the submission of data, making sure that you have an eye on the time frame for when you need to submit your data. We at CMS highly recommend that you send in your data to CMS before the submission deadline, which is March 31st of 2018. So depending on how you're participating in MIPS, you're capturing data about your performance in 2017, and you'll be tracking your progress throughout the year. You'll begin submitting this data on January 1st of 2018, with the deadline for getting that information to us by March 31st of 2018. So again, highly recommended that you submit your data early so as to not miss the deadline, and make sure that we have timely receipt and accurate data. So remember, these steps we've just been discussing will help participating in MIPS possible for all eligible clinicians, really regardless of their previous experience with any of our legacy programs. CMS would really encourage you to discuss MIPS with your colleagues, with your specialty societies, and with CMS, as we are working together to learn from your experience and to continually improve the program to the benefit of not only you, our clinician partners, but also your patients.